In GIT topic, there is a subtopic called as peptic ulcer subtopic. So today we will see the peptic ulcer. So this will help you to write in your university exams. This is a very common topic asked in exams. This may come as a 7-mark question. So first we will see what is peptic ulcer. First we will see definition of peptic ulcer. So what is peptic ulcer? Peptic ulcer means ulcer in the stomach or duodenum. So, what is ulcer? The proper definition which we may give is discontinuation in the epithelium of a GIT, of a stomach or duodenum is called as peptic ulcer. So, mainly there are three causes of peptic ulcer. So, what are the causes of peptic ulcers? We will see. Let's see the causes of peptic ulcer. So, we have represented here as a flowchart. There are mainly three causes. First is diminished effectiveness of mucosal barrier. Means there is epithelium in the stomach which of which effectiveness of a mucosal barrier is decreased. So why it may occur? There is mucus coat on gastric epithelium of stomach. So whose pH is alkaline. When the mucus secretion decreases, its effectiveness of mucosal barrier decreases. It may be decrease in mucus secretion may be due to the chronic use of NSAIDs and chronic stress. So what will use of NSAIDs will do? First of all, NSAIDs means non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs such as aspirin and diclofenac, they cause decrease in mucus secretion. And another reason for decreased mucus secretion is chronic stress. Chronic stress leads to increase in catecholamine secretion, which causes a decrease in mucus secretion. The second reason of peptic ulcer is hypersecretion of acid. Hypersecretion of acid, as we all know, HCl is secreted due to the influence of gastrin. Gastrin is a hormone. So due to the influence of gastrin, HCl secretion increases. So why does the HCl secretion is more or there is hypersecretion? There may be three reasons: hurry, worry, and curry. So this is a very famous mnemonic we use here. Like hurry, worry, curry. If we eat in a hurry, if we eat in a tense situation, or if we eat too much spicy food, it causes hypersecretion of acid. So there is another cause of hypersecretion of acid, that is Zollinger-Ellison syndrome. So what is the Zollinger-Ellison syndrome? It is the tumor of pancreas, means non-alpha, non-beta gastrin secreting tumor of pancreas. So what is it? It causes the stimulation of gastrin release, which causes further HCl secretion. So HCl secretion will increase, finally lead to it will hypersecretion of acid. So the third reason why peptic ulcer is occurring is Helicobacter pylori infection. It is a bacterial infection. First of all, what will happen? The Helicobacter pylori is present in the duodenum region. So Helicobacter pylori will secrete one enzyme called as urease, and urease will convert urea into CO2 plus ammonia. So what will happen here? Urea will break down into ammonia ions. So there is abundant H plus ion in stomach, which causes ammonium ion, ammonium NH4 ions in stomach, and it will cause a buffer which will cause a local inflammation that will finally lead to the ulcer. So these are the main three causes of peptic ulcer. You can represent these three causes as it is in your university exam, and you can get up to full marks. You can get full marks. This is a very easy and convenient representation for the examiner to check. So we will come towards our next topic. What is the clinical features of peptic ulcer? Clinical features of peptic ulcer. So first clinical feature is upper abdominal pain. So as you know, stomach is present in the epigastric region, left hypochondrium region. So there will be pain in upper abdominal region. So what are the other clinical features is that abdominal pain in empty stomach, which is relieved on taking food or any liquid. So it has physiological basis why there is pain in empty stomach, and it is relieved by taking food. So what are the again other clinical features we will see? There is hematemesis, that means vomiting of blood. So what will happen? There is a due to ulcer, blood will come into the stomach, and as due to the acid reflux, when we omit, the blood will come in the vomiting. So melena, dark stool. As we know, if a ulcer burst, then blood will go into the intestine and it will pass through stool, which causes melena or dark stool. Eventually, the red blood will become dark and excreted into stool. So first of all, we will see the treatment of gastric ulcer. So what is the treatment of gastric ulcer? First of all, we will give the subject or the patient H2 receptor antagonist drugs such as ranitidine, cimetidine, famotidine. These are the hydrogen receptor antagonist. As we know, there is a hydrogen potassium pump hydrogen potassium ATPase or hydrogen potassium pump in the stomach. So we will give it H2 receptor antagonist to block it. Then we will see gastrin. As we know, gastrin is a potent stimulator of HCl secretion. So we will give gastrin blocker drugs such as proglumide. Then what is another treatment? Antibiotics to kill the Helicobacter pylori. As we have seen, three main reasons. First is hypersecretion due to gastrin. We have the treatment as proglumide. Then we have the cause when you have the cause of peptic ulcer, that is Helicobacter pylori, we will give antibiotic to kill the Helicobacter pylori. This is again the common treatment in gastric ulcer. Then proton pump blocker, as we have seen, the omeprazole is a proton pump blocker. Again we know proton pump means hydrogen pump. So this is all about the gastric ulcer, which you can get a 7-mark question in your university exam, in your semester exams in first year MBBS in physiology. It is very common asked question. If you want, I can give you this notes. You can write as it is and secure a full marks, as it is point wise and detailed description of the topic peptic ulcer. If you like the video, thank you.